Yeah, my name is Latima Mwaniki, retired Air Force captain. Um, Around 2010, I've always been a very ardent squash player and good in sports. I started having hematuria, lots of blood in my urine after squash, which was painless. Later, it was diagnosed as bladder cancer. I went through chemotherapies. And then finally, I was told that the bladder was very bad and that it might have to be removed. So I heard from friends that in India I may be able to get good chemotherapy. And I decided to ask around, and I was told about Dr. Taneja. I Googled and found that he was a good robotic surgery in urology. And I decided to come to see him. When I came to see him in 2014, he told me there was no cancer in my system. So he sent me back to Kenya, that I had no problem at all. But after a couple of reviews, in 2016, he found that the bladder had full of cancer. And he decided that we must remove it. We removed it in 2016. And I've never had any problems. I've been here every 6 months for reviews. Last year, he told me it's 1 year review. I'm now back in for the annual review after 2018. Now it's 2017. And I've had no problems at all. So far, I'm doing very well. I still jog. I still swim. Back in Kenya, I'm running a small aviation school, which is pretty busy. And I'm not having any complications at all.
Thank you very much, Mr. Latimer, for all those kind words. So I'm Dr. Rajesh Taneja. I'm a genitourinary surgeon, urologist, and a robotic surgeon. I've been having my practice for the last 30 years in urology, and I've been doing robotic surgery since 2012. And Mr. Latimer came to me with the diagnosis of cancer of bladder, but since he had received chemotherapy, on the initial reviews there were no cancers, so we kept him on follow-up. But later on, during the follow-up, we picked up the signs of cancer coming back. And this time, we decided to take the bladder off. So I conducted a robotic surgery, robotic radical cystectomy, with an ileal conduit diversion on him in February 2016. And it went off uneventful. And I'm very happy to see that he is enjoying good health. There is no recurrence of cancer. And he's maintaining good health, good sports, good jogging, and he indulges in his usual sports activities, which makes me very happy to see a patient like that. And I hope that the robotic surgery brings such good health to all the patients all over the world. Robotic surgery makes a big difference in as far as the incision is concerned. You don't have to make huge incision in the abdomen. And when we do robotic surgery, the blood loss is minimal. The robotic instruments have endo wrists, which go in. The width of the endo wrist is 6 millimeters. And if you compare it with my wrist, which is 6 centimeters, you can make out that the finesse of an endo wrist, which is 10 times smaller than my hand, is certainly going to be much better and much more precise in terms of dissection and reconstruction of the tissues. So that is why robotic surgery gives a much better result in terms of recovery, in terms of clearance of cancer, and it is very kind to the patient.